I would definitely like for people to have an understanding about the ending the epidemic concept, the concept that we can do it. I want people to know about those disparities because I want people to ask why is it working for white MSM and not working for us. And but with that, I want hope always. I really want, I think a lot of times in places where communities are disadvantaged, there could be that sense of this is the way it's going to be. It's not going to, it's just, that's just the way it's going to be. And so I really want to instill that hope that we do have this safety net. We do have a different standard of care than we did at the beginning of the epidemic. We do have options and that people need to be held accountable in their local communities. There's somebody in your community that's getting paid by the government to serve you. And if you're not being served, and if you're not being served at your, whether it's at your hospital, whether it's at wherever it is, if you're not being served by the people who are paid and that's their job to serve you, and those are things we need to highlight, and we need to hold accountability for what is the data and the situation in our community, and then how do we keep our eyes on the prize? Because I think HIV can be one less problem for our community because we have such a robust tool set. But we got to get there, and we got to get there together.
I would say cover the good news as well as the bad news, and I think the good news is the progress that is present in treatment and prevention. I would say look for opportunities to cover HIV and just for the awareness. I mean, we mentioned that we're coming up on the 40th anniversary of sort of HIV in this country, but we're also coming up on essentially the 30th anniversary of Magic Johnson being diagnosed, which captures the energy and attention of Black folks. And when I talk to the community about Magic Johnson, I talk about how wonderful it is that he's on treatment, living his life and healthy. But I contrast him with another very famous Black man from Los Angeles, Eazy-E, who when he was diagnosed with HIV, he was diagnosed with AIDS. He had very advanced disease. He was hospitalized. He essentially never left the hospital. And so, there a lot of folks have sort of been reacquainted with him through some of the recent more coverage of the group, but and the members of the group who are still around, like Dr. Dre and all of them. But I mean, so those are angles that I think are just something that can come up. What's the difference between the lives of those men and where we are now, and how folks can be more like Magic and here 30 years later. And so I just say cover the good news and find a way to think about ways to inform our community now.
Yeah, I really resonate with everything that's already been said. I'm not a journalist, but I would imagine that as a journalist, I would know and believe that if I was only reporting on one part of a story, that most would agree that I'm not doing my full job. And that there is an inherent privilege in being able to tell stories. As a storyteller myself, I know that comes with privilege and an opportunity to set the narrative, to set the social culture around an issue. And so I think what's been said is crucially important. Let's tell the whole story, not just the negative aspects or the once or twice a year when there's a big anniversary or an HIV awareness day. Let's figure out ways to tell the stories of the Oregon Cares Fund or the impact of Black women in the South, or the day-to-day struggles that folks are having to access care and treatment while the rest of the world appears as though HIV is becoming more of a long-term chronic illness, but yet not in these pockets of communities or pockets of our country that really need a story that highlights not only the struggle, the policy challenges that need to be overcome to create better access and opportunity, but also the passionate way that people are learning to live and thrive with their disease, and how those stories will help other people feel safer to get into care, treatment, and to know their status.